Hello everyone and welcome back to the Burlington Central Brain Bee YouTube channel. My name is Josephine and in this video we are going to dive into chapter 3 of the Brain Facts textbook, which is about movement. On this channel we are kind of doing each chapter per video, so if you haven't already, please go check out part 1 and 2, which covers brain basics in chapter 1 and then senses and perception in chapter 2. So with that being said, let's get started with movement. In order for us to understand the neuroscience of movement, we need to understand the types of muscles there are and how they work. So in terms of the types of muscles, we have two main types. We have flexors, which decrease the angle between two adjacent bones. For example, your humerus is your upper arm bone, and then you have your radius and ulna, which are your lower arm bones. And obviously there is a joint in between them. So the flexors would be the muscles that will contract. So for example, you have your humerus in your upper arm and then your radius and ulna in your lower arm, and they're connected by a joint. So when you bring those two closer together, you decrease the angle, right? When you're flexing, when you're lifting something up, that is involving the flexor muscles. Now, flexor muscles work in opposition with extensor muscles, which increase the angle between two adjacent bones. So if you were to relax and lower your lower arm, right, you would increase the angle between your humerus and your radius and ulna. You would be using extensors to do that. So again, they work in opposition. One cannot be working while the other is. There are also two types of muscles in general, which are agonists, so they promote movement, and antagonists, which inhibit movement. So you might think that antagonists are kind of the bad guys, because like in a storybook, for example, the bad character is the antagonist. But antagonist muscles are actually super important for skilled movements, which are started by agonists and stopped by antagonists. So an example of a skilled movement would be throwing a dart, right? You need to start moving for that to happen, which is done by the agonists, but you need to be able to stop it at the right time for your aim not to be off. So that's why antagonists are important. They're also important for co-contraction, which happens for balance and stability. So for example, if you are trying to balance on one leg, you might notice that at some points you're a little bit wobbly, you might start jumping around, and that's because the agonists and antagonist muscles are both contracting, trying to keep one another in check. The agonists have to contract in order for you to accomplish the movement, but the antagonists have to contract to prevent the agonists from overdoing it. So that's how you're able to balance, is mainly due to antagonists kind of preventing too much movement. So the neuron that connects to muscle cells, which are also called muscle units, are called alpha motor neurons. And when you consider an alpha motor neuron and all the muscle units it controls, because some of them control multiple at once, you call that a motor unit. So that's kind of leading into the neuroscience part of things. Now, an important type of movement are reflexes, so we're going to discuss those in a second, but when motor neurons die, so those alpha motor neurons that I just talked about, people can unfortunately lose their ability to move. So a condition that targets motor neurons is called amyotrophic lateral sclerosis, or ALS. A famous scientist who died of ALS was Stephen Hawking, and it's a detrimental condition because it targets the motor neurons, and eventually all of your muscles will get so weak and paralyzed, working its way up to your intercostal muscles, your diaphragm, your heart, just all those vital those muscles supporting vital organs, which leads eventually to death. As grim as it is important to kind of make this connection because there are a lot of clinical aspects of the brain bee competition as well. So there are voluntary and involuntary movements. Voluntary movements are those that we control, right? We ask our bodies to do those things. We are aware of them. They happen consciously. Involuntary movements happen without our awareness and our kind of triggering. So, for example, our heart's beating happens involuntarily, breathing happens involuntarily, and so on. Another type of movement that happens involuntarily is the reflex. So, it's an automatic muscular response to a particular stimuli. These responses are actually so fast because they skip the brain. They go to the spinal cord and back. So it's a really quick kind of turnaround, just enough for the spinal cord to identify the stimulus and to quickly, react, but nowhere near enough for you to be able to process the situation and in as much depth as the brain would. So to recap, the spinal cord is split into 4 main sections. We have the cervical, thoracic, lumbar, and sacral from kind of superior to inferior. And for brain bee, you don't need to know every specific kind of vertebrae, but these 4 sections are a good way of kind of being able to categorize things. So yeah, the gist of reflexes is that they're involuntary, automatic, they're a response to stimuli that happens without the brain and only uses the spinal cord and peripheral nerves. All right, now there are 2 main types of reflexes that, well, there's more, but these are the ones that are talked about quite a bit in the chapter. So there's the knee-jerk reflex, which we will talk about in more detail. And then there's flexion withdrawal reflex. We're not going to talk about this. It's not going to have its own slide, so I'm going to quickly kind of summarize that portion. Essentially, if you were to step on a sharp object or touch something really hot, the flexion withdrawal reflex will allow you to remove or withdraw your limb from that source of damage. And it's super important for protecting your body. It's a reflex, so it happens without the brain. That's why if you burn yourself, you will immediately remove your hand without even thinking to. If you step on something sharp, you'll immediately lift your leg without thinking to. And again, it has to do with either flexors or extensors contracting. They can't contract together. So if one contracts, the other relaxes. So let's look into the knee-jerk response. This is a nice diagram to demonstrate what that looks like from a neuroscience perspective. But step 1 is that the doctor will strike the tendon. Quick review, tendon is a tissue that connects muscle to bone, not muscle to muscle. Muscle to muscle is ligaments. So tendons connect muscle to bone. And a physician will strike the tendon just below the knee with a hammer. Now, what this is going to do is it's going to cause a stretch, or what they call myotatic response, of the knee extensor muscle, and it's going to cause your leg to lift, right? So your lower leg, your fibula, it's going to lift. And this movement is sensed by receptors, specifically muscle spindles, to send impulses to the spinal cord. So as you can see, there's a cross section of the spinal cord, and you have a quick kind of impulse being sent there. And the alpha motor neuron is activated to cause the stretched extensor muscle to contract. So the alpha motor neuron, the receptors quickly send impulses to the spinal cord. The alpha motor neuron is activated. It causes this stretched extensor muscle to contract. in order for the reflex to happen. So the flexor muscle relaxes at the same time, and that is called reciprocal inhibition. So I mentioned this earlier. When one muscle contracts and the other one relaxes, that's called reciprocal inhibition. And it's super important because you can't have an extensor and a flexor contract or relax at the same time. Perfect. So the purpose of this knee-jerk response is not just in the doctor's office, but it's to help you stick your landing. So if you were to jump off of a chair, or just if you're a gymnast and you are doing some sort of, flip, it's this reflex that's going to allow you to stick your landing and not fall when you do kind of hit the ground. So that's the importance of the knee-jerk response, and that's kind of how it works. Next, we're going to talk about the structures of muscles that contribute to our ability to fine-tune certain movements. So we have muscle spindles, which I've mentioned quite a bit, that detect changes in muscle length and stretch. So muscle spindles are really going to tell you how long are your muscles getting, how far are they stretching, is it too much, can it happen more? And it sends that information to the brain to adjust the sensitivity of the system. So really, you'll begin to realize that movement and coordination is all about fine-tuning and just those small corrections in adjusting your movement so that you don't stretch too far or throw too hard. And then we have Golgi tendon organs, which are located where the muscle attaches to the tendon. And again, the tendon attaches muscle to bone to detect force or tension applied to muscles during a fine movement. And then the brain is going to fine-tune those movements. So muscle spindles are more for length and stretch, and then Golgi tendon organs are more for force and tension. Both super important. There are certain neural circuits in the brain called central pattern generators that are in the spinal cord and brainstem, not the brain, that perform rhythmic, voluntary movements without the input from the brain, like walking, cycling, and swimming. These are things that you can do involuntarily without, you do need to initiate the process, but in order for you to continue doing it, you don't have to excessively think about it, right? Walking is just something that is natural to us, and it's due to these central pattern generators. Perfect. So let's look into the regions of the brain that are involved in movement. There are two main ones that we're going to focus on and that we're focused on in the chapter, but those are the basal ganglia and the cerebellum. So the basal ganglia facilitates desired, target-oriented, or wanted movements, while inhibiting competing, unnecessary, unwanted movements. So if you're throwing a dart, for example, the basal ganglia is going to promote those neurons that are helping you to throw the dart forward, while inhibiting movements that would want to pull your arm away or would want to continue throwing too far. So it's really just a center for fine-tuning movements and making sure that you are not overdoing or underdoing things. And then we have the cerebellum, which deals with motor coordination, balance, posture, acquiring new motor skills, adapting to the unexpected, and growth. So for example, if you are a teenager and you're having growth spurts, the cerebellum is going to help you adapt to, a new walking style, or just being able to move without feeling like you're in the wrong body. And then if you, let's say, put on more weight, the cerebellum is also going to help you to manage that movement as well, or if you lose weight. And then the cerebellum is actually really affected by drinking. So acquired cerebellar degeneration happens for people who are alcoholics, and that's because alcohol directly affects the cerebellum. So those are the two main parts of the brain involved in movement. And of course, there's others like the thalamus, for example, that relays motor information, the primary motor cortex as well. But I just wanted to focus on those two. And last but not least, let's look at movement disorders. Again, the two primary ones focused on in the chapter are Parkinson's and Huntington's, but there are a lot more that you can explore. So, Parkinson's disease is caused by a degeneration of dopaminergic neurons in the substantia nigra. So, let's break that down. Degeneration just means the death and weakening of these neurons, and dopaminergic neurons are neurons that produce the neurotransmitter dopamine. The substantia nigra is a dark pigmented area within the basal ganglia. So if you can remember, we just talked about how the basal ganglia deals with like fine-tuning movement. The substantia nigra is a part of the basal ganglia that produces dopamine. And Parkinson's disease, those neurons are weakened and most of them die. So the symptoms of that include resting tremor. So when a person is just resting, they're not doing anything physical, they will still have that shaking movement. Bradykinesia, which is just slow movement. Akinesia, which is no movement. And then a mask-like face. So it's almost like they can't show emotion on their face as much as they used to. And then rigidity. So there might be a more kind of rigid posture, just like the muscles feel more rigid, and so on. Parkinson's is typically treated with the drug levodopa, which is a precursor to dopamine. So it raises dopamine levels in order to kind of counteract these symptoms, but it is not the most effective in the long run. So another explored treatment is deep brain stimulation, or DBS, where electrodes are implanted into specific areas that are causing these abnormal movements, and they try to override those abnormal signals with those electrodes. It seems to be a pretty well kind of successful field as well. Now we have Huntington's disease, which is another movement-related disorder, but Parkinson's and Huntington's are quite different. So the cause of Huntington's is due to a 36 or more repetition of the CAG codon. Codons are just 3 nucleotide long sequences or parts of a gene. And so in someone with Huntington's, there's that much repetition of a certain gene that leads to the selective loss of inhibitory neurons in the basal ganglia. So remember how the basal ganglia inhibits competing movements, which are movements that are undesired or unwanted. So they might be excessive, right? When you lose those neurons, you end up doing things that are unwanted. So symptoms include chorea, which is derived from a Latin word for dance. And this is characterized by a jerking movement, making, unconventional movements, just involuntary jerking, shaking, moving, rigid posture, personality changes, and so on. So those are the two main movement disorders that were covered in Chapter 3. Although there are many more like ALS, there's also cerebellar ataxia, which comes from cerebellar damage. There's Tourette's syndrome. There is myasthenia gravis, which is an autoimmune condition that targets acetylcholine receptors. There are a lot more movement disorders out there that may be tested in BrainBee, but I wanted to focus on these two for this video. So let's recap everything that we've covered today because it's been quite a detailed lesson. So reflexes are involuntary autonomic responses to external stimuli that do not pass through the brain. They go straight to the spinal cord, to an alpha motor neuron, and back. Examples are the knee-jerk reflex and flexion withdrawal, and these are the 4 sections of the spinal cord. The 2 main disorders that we covered in this video today, these are just examples of movement disorders, include Huntington's disease and Parkinson's disease, although there are several other ones. In terms of muscles, there are agonists, which promote movement, antagonists, which prevent movement, flexors, which decrease the angle between 2 bones, and extensors, which increase the angle or extend. And then we have co-contraction, which allows for stability and balance. And we know that agonists start and antagonists end very skilled movements like throwing a dart. Important structures that we talked about include muscle spindles, which detect stretch and muscle length, Golgi tendon organs, which detect force and tension, and central pattern generators for rhythmic, almost involuntary movements. And we have 2 main parts of the brain that deal with movement, like the basal ganglia and the cerebellum. So with that being said, if you have any questions at all about what I discussed in this video, please leave them in the comments down below, and I'll be sure to reach out to explain. In our next video, we're going to go straight to chapter 4 and talk about learning, memory, and emotions. So yeah, if you haven't seen chapter 1 and 2, I'd highly recommend that you go check those out after this video, and stay tuned for chapter 4. Thank you so much. Bye.